Welcome to episode 10. I'm your host, Dr. Carl Bernstein, and this is Triangle Dentistry Talk. We're here today with Dr. Diksha Katwal. She is with Tar Heel Periodontics, and we are so excited to have you on today. How are you?
Hello, I'm good. Thank you so much. Thank you for having me here.
Yes, and today we are going to be talking about periodontics and the systematic health.
Yes,
And how's that sound?
yep, period disease and its association with systemic health. That's
So
what.
I think this is really important. Obviously, most people, and especially I think people out in the community, aren't as aware how much the oral health affects the rest of our body. But before we get there, let's learn a little bit about you.
I'm Dr. Diksha Katwal. I am originally from Nepal. I did my DDS from UD Mercy School of Dentistry from Michigan. Then I did my peri residency from Indiana University. I was a tenured associate faculty at University of Louisville School of Dentistry for 10 years. And at the 11th year, I decided change of sceneries, and I moved to North Carolina 2024 January and started to work at Tar Heel Perio from January 2nd of this year. Almost been a year now.
Yeah, that's a long time.
Time flies, isn't it?
It does. It's kind of sad, but we're all getting a little bit older, a little bit older every day.
Let's
But we
talk.
don't talk about it. We're all really young inside. So one thing that obviously I heard is means you are very knowledgeable. You're teaching our young dentist, so she knows everything now. But she definitely is really knowledgeable because already from the few conversation I was able to have with Catwall before, I already learned a little bit. So I'm excited. So let's kind of get started. Where do you want to start?
I think we'll start from the period disease. We kind of are in a very good era right now. So compared to where we were, periodontal disease, when we talk about it long time back, it was like, yeah, it's a mouth, and everybody considered it as a separate part of your body. But now we are so much ahead. The systemic health and periodontal disease, we have so many correlation between them. Now we do consider our oral health as a part of our overall health. So if you look at the period disease, it is basically a inflammatory disease. And if you look at other part of the body and look at how many other diseases are caused by inflammation, and if you look at the association, you will find they are very, very closely related to each other. If you look at period disease right now, in US, 47.2% of the adults have some form of periodontitis. And periodontitis actually is considered sixth highest ranked systemic disease. One of the systemic diseases, sixth rank. So it's pretty high there. So according to the CDC, it is a most prevalent diseases. And if you look at the 10 most, there are so many, right? But if you
Yeah.
look at 10 most, they talk about hypertension, obesity, high cholesterol, heart disease, diabetes, arthritis, periodontal disease, cancer, depression, Alzheimer's. All these diseases have something common with periodontal disease. So we're going to just talk about how they're associated and what can we do so that we are telling our patient or educating our patient the correlation between those two, and if we can prevent or if we can manage one by managing the other. That's what we're going to talk about.
And I think I'm excited. I am excited to hear some of this because, as me being an orthodontist, so dentist as well, but not as knowledgeable in this area as you are. But uh, we know that this is something that is, in a way, easily manageable. It's much easier to and much quicker to get under control than some of the other issues that you had mentioned that take time and maybe medication for some people, but they take time. So I think this is this. Like I said, I'm excited. I'm excited to hear some more. So let's keep going.
All right. So I'm going to start with the first and foremost, the biggest thing you hear about most of the time when the patient comes to your chair: cardiovascular disease. Patient who have strokes, patient who say that they have been taking medications because they think they have a high cholesterol and they're trying to control it so that they don't have a stroke. Those patients, if you look at them, the inflammatory factor are very high in those patients, and same with the periodontal disease. And also another thing, if you look at the research, the patient who had those artery blocked, but they built up all those plaque in the arteries and that's how they get the stroke.
Hmm.
When they removed those plaque from the arteries and they looked under the microscope to see what kind of the bacteria you actually find in them, they actually found the same bacteria you found in a periodontal disease. So see the correlation? It's that bacteria in a mouth does not stay in the mouth. So when you think that, most of the time, you and I get the questions about why do I have to do this? I've also heard a patient say, I have 32 teeth, one or two missing. If I have some inflammation, what happens? And I see the point. You have two eyes, more important than 32 teeth. But the inflammation that causes a periodontal disease is the bacteria that are there that does not stay in the mouth, that go into your blood circulation and goes into the entire part of the body from head till the toe. So if there is high inflammation in your mouth, if you have a periodontal disease that's not under control, those bacteria can travel into those arterial.
I know we have another podcast with Dr. Valentine, who
Yes.
also is with Tar Heel Periodontics, talking about periodontal disease and really going into kind of the field and understanding of that. But real quick, how would a person, if someone's listening to this,
Yeah.
if they don't go to the dentist, how would they say, I may have periodontal disease? What is just a quick, we don't have to go in depth. They can follow, I don't remember which episode, but the one with Dr. Valentine. But what's a quick thing they can say, what, maybe I need to go and have this looked at?
That is an awesome question. I think the first thing before they come to the dentist, most of the time when they come to the dentist, they know it because while they brush in the morning, they see bleeding. That is the first sign. Even if they, in their minds, like, once in a while, I get it, but they actually can see the bleeding. That's the first sign. And if you ever see a bleeding while brushing, you have to go to the dentist and kind of get it checked so that you have a periodontal disease, or even if it's the milder form, it starts with the gingivitis, which is just the inflammation. But if it can be checked earlier and taken care of it earlier, you can prevent from the gingivitis going into the periodontitis. So that will be the early check sign.
Now, when people go to the dentist and maybe specifically then the periodontist and seeing you with more invasive and higher inflammation and maybe more bone loss, gingival recession, whatever it may be, some people, I think most people think, if I'm not going to notice any difference and feel any difference, how is this really benefiting me? But I think, as dentists, we know you do feel better. I think even with just getting the nice cleaning,
Yes.
obviously eliminating infection. But what would you say to people, who kind of say, that in the sense, I don't know if I don't care. I feel fine, but they may not know they feel bad.
Yes. And that is an awesome question because most of the time when the patient comes to us, and that's the biggest question they have, I never felt any different. So, what would you do that will make me feel different? And to a certain extent, when you have so much of an inflammation, it's not just in the mouth. You will feel sluggish. You will feel that other part of the body is also working towards that inflammation. When you have a smaller cut, your whole body tries to go into that area to heal it. Now think about having so much of an inflammation in the mouth. The entire body is trying to work on that area. So rest of the area starts getting neglected. So that will also create an other factors. Okay, so I'm going to give you a very good example. I had a patient
Awesome.
who came day before yesterday. So when he came, he kind of told me, I think I need a some kind of a cleaning. So he didn't specify. And he said, I asked him, so what makes you think that you needed some kind of a cleaning? Have you feel anything different? So he goes, I was talking to one of my dentist friend. He's a dentist friend, and he said that he's been having some problem with his stomach. He said otherwise he's perfectly healthy person. He's like, it's been like a month or so. I'm having some uncomfortable feeling in my stomach. And my dentist friend told me when you have inflammation, you can have everywhere affected. So
Hmm.
he came. We actually did it. He had very, very severe periodontitis, stage 4 periodontitis. So we did a scaling and root planing, and I saw him for re-eval day before yesterday. And he actually told me we did give him antibiotics in conjunction because of his how much progression of his periodontitis was. And he actually said he actually feels better. His stomach started feeling it better. Because that's a perfect example. Like when you don't know what's going on, you kind of have this perspective like, yeah, I don't feel wrong. So
Right.
must be perfect right now.
Now, what did he say was the feeling in his stomach? In the sense, was it like pain, bloating,
So
just not
yes,
just a weird feeling? I mean, what?
yeah, that was his first thing. He said, I kind of feels not happy. That's his word. So I did tell him, you use yogurt and probiotics. Do you use any of those things? He's like, I've tried all that, but I don't think it's going to help. Then when I looked into the mouth, I kind of agreed with him because he had so much inflammation and I could see it, association. So I know we say it day in, day out to our patient, but when
Mhm.
patient comes and tells us, hey, I think, even though he's heard from somebody, but when they come and say, this is what I was and now I feel better, hey, there is definitely some association in there, right?
Yeah, I think another thing that it sometimes gets lost a little bit with periodontal disease and inflammation in the mouth is, and I think a lot of doctors in the medical profession don't necessarily think about the mouth. They got a lot of other things that they're looking at, that they're worrying about, and the mouth, in a sense, comes second or third or fourth maybe. But I think some of it starts to getting to some of that information to the medical profession as well, is in just teaching them. But you know do you ever hear patients come in and say, well, my doctor didn't mention anything about this, so it's not really my main priority. I want to work on something else that they mentioned. How do you kind of communicate with them that the systemic health starts from the mouth? Whatever you eat, it always comes in for
Yeah.
most people through your mouth. So it's it's important.
Yes, Dr. Bernstein, that's an amazing question. Uh, I've been in a perio world for a little time. Okay,
Just a
so
little.
just a little time. So, and I've seen the difference before and now. Okay, when I was in a residency, so think about this case. When the patient comes, they have lots of gingival overgrowth. So gingiva is growing rapidly and they don't know why it's causing. They do tell you, hey, I brush, but now gingiva has grown so much that it's hard for them to clean that area. Okay, now, there is a medication this patient is taking. He has a high blood pressure. So he's taking a certain kind of a medication, which in a research, if you look at it, that shows that it causes a gingiva to form faster. So you have gingiva start growing too much. Now, slightest amount of a plaque and overly formed gingiva can cause so much of inflammation. So during my residency, if I have to tell my patient, and exactly what you said is what I'm going to hear from the patient, my doctor never told me that my hypertension medication, which is very important to him,
Yes.
is going to cause some problem in my mouth. And guess what? This is more important for me than my mouth getting inflamed. But now I can pick up the phone and talk to the medical person and say, hey, you're using this kind of a medication. Can we, if it's possible, can we change it into a different one and see if that can regulate? And they are more open to it. I know there is, I think it's because of how far we have gone into the research to show the association, the problem that can create. They are more open to listen to us and work with us to changing those. That is definitely better now.
So when it comes to communicating with the doctor, obviously giving them a call, and never, we understand we're all working as a team. Each person is an important aspect to that patient's good good health and to the plan in that sense, to get them to be healthy, and as well as their whatever it may be.
Yeah.
How have you had any ever pushback in the sense of that maybe, I don't necessarily think that you're telling me is accurate?
Yes, we do. I think before we used
And
to.
that is not only to medical doctors. I've talked to dentists that I get pushed back as well. So I'm
Yes.
not calling anyone out. I promise you.
No, you and I know, even when we have this idea formed in our head, this is what is happening, and we have read some things, and it's kind of we have mind makeup, so it's hard for us to change. It's for everybody, you, me, everybody in this world. But when we show them the research and then say, hey, there's other research, and I'm very open to having a conversation. I don't mind going to their office. I don't mind picking up the phone and saying, hey, these are the research I'm forwarding about, talking about. If I want to, I'll send it to you. And they are very open about it. Yes, once in a while. Right now, if you talk about pushback, this is where I get the pushback, and I don't blame them for it, because let's say that's the only medication that's working for the patient.
Okay.
Right? In those cases, they won't be able to change it. And then what we have to do is, from our perspective, we have to do a surgery to keep removing those excess gums so patient does not fall back into the oral health care. That's how we control it.
I know we kind of step back here. I know you mentioned, more recently, obviously the systemic health and dentistry and inflammation, periodontitis has become a much more hot topic in the sense of what we know and our knowledge in this field. But when would you say, you've been practicing just a little bit longer, not much, but have you noticed in just your time that it's changed, or is it more as when you started, things were already kind of the wheels were going in motion, but, or has it been even every few years you're just noticing a big change in the knowledge, obviously in that sense, but in how we're acting and treating patients?
Yes, most definitely. I think uh, before it was like, we take care of the oral health care. Yes, we do. Every dental chair you go to from school, you take a blood pressure, you take a pulse, and then you kind of go over the medical history. But that's what we did. And then we took care of our oral part. We kind of didn't link too much about, hey, when your diabetes is not controlled, whatever I do in my oral healthcare, like I'm a periodontist, so I do a lot of surgeries. So if the patient's diabetes is not controlled, when I do a surgery, he's not going to heal well. She's not going to heal well. So that wasn't there as much before. But as the research is progressing, as we are looking more and more into body as a whole, and mouth is not a separate part of your body, and everything what you take from a mouth to every part of the body is going to work exactly as a system. We work as a system, right? So more and more, if you look at the research, and I think there are more of the people are looking into what other things you can associate it with it. So we treat everybody as a whole, not as a, okay, diabetes is my part, liver is my part, I'm going to take care of this, mouth is yours, you do whatever. And every system you look at it, and even when you go to the pediatrics, like when I take my kids to the doctor, they actually ask you about, hey, do you brush, do you floss, do you go to the dentist? We have become so much better. I'm not saying this is where we are, like end of it.
Right.
We still have to a long way to go, but we are definitely going into a right direction when it comes to parental disease or any other disease, oral health care, compared and associating with it with the systemic health.
And I know we mentioned it earlier, but what are all the things that you have seen in research that can be associated with inflammation in the mouth to systemic health? I mean, obviously the big ones, which you'll mention, but I mean, what are some smaller ones that people may not think of health diagnoses that may say, I didn't even have a thought that could be related to at least some inflammation coming from poor oral health?
Yes, and that's the biggest stuff, right? Because when we talk about health, we say, okay, heart attack, diabetes, those are the big thing, big topic, big research, big money in it. But the small things, like, I know it's not small, but arthritis. When your patient have osteoarthritis or rheumatoid arthritis, the inflammation that causes those disease, and inflammation in the pattern disease, it's correlated heavily. There are also a lot of research when they take care of the oral health, they do deep cleaning or scaling and root cleaning and take care of the oral health. They have shown the inflammation factor in the rheumatoid arthritis, osteoarthritis has been reduced.
Oh, nice.
Alzheimer's is another disease, which is, you know how it is, progressively you see more patient, there's nothing you can do about it till now, and we are moving more across
Mhm.
finding solution for it. But there has been shown a research association between parental disease, the bacteria, the inflammation traveling from your oral cavity to the brainstem.
Wow.
And see, there are not just one thing, there are so many diseases. You talk about depression, you talk
I
about
was just going
stress.
to ask, what about, mental illness and mental health is becoming so much more important, and we're finally focusing on that and trying to, not make a stigma about it. But how much, it's obvious, it probably isn't going to make someone go from one spectrum to the other, but it obviously has some correlation. So what have you seen with that?
So stress has a big factor that we kind of, everybody, our life is stressful. We go in and out, like our patterns.
If you don't have stress, tell me what you're doing, please.
Exactly, please. We all want to know. Please let
Yes.
us know. So stress causes so much problems in our immune system. And think about it, you have an immune system that is overloaded by the stress. And suddenly you have another thing to focus on, that's a periodontal disease. These periodontal pathogens, which utilizes these stress hormones really nicely and flourish. So it's like just not causing the immune system to not work, but then use these stress hormones to bacteria to increase more than what when you're not stressed are. Okay. And also when you have issues like when you're stressed, one thing you forget is to brush your teeth.
Yeah.
Do you remember? You do,
Or
it's like when you're
depressed,
stressed.
and or eating or
Yeah, I mean, you kind of forget to do those regular things when you are stressed, when you're depressed, and when you neglect those things, and you're not doing it purposely, but because you have so many other things you're dealing with, you tend to forget because you think it's a minor thing. However, when you are stressed, when you're depressed, the stress hormone bacteria flourishes on it, and the immune system going down cause a lot of issue. And then you see fall down from there to your other systemic health, and that's when you go into the deeper problems.
let me, and this may not be everyone, and I don't know what the percentage of people is with missing all their teeth,
Mhm.
but, what if someone says, I don't have any teeth, all my teeth were taken out. Can I still have issues with inflammation or in the mouth?
That is amazing question. Somehow we periodontists, have you realized we work around the teeth? We don't work with the teeth.
Right.
We work with everything else. We talk about gums, the bone, the everything inside that. But when you talk about teeth, we're like, that's not our part. But see, inflammation, it's not just when you have a teeth. Yes, the bacterial load are less when you don't have any teeth at all. But if you wear a denture, then you're going to have that denture associated with other bacteria that can.
Mhm.
If you have an implant, then there are other bacteria that you can find. And if you look at the research, the bacteria that are found in an implant and periodontal disease, if you have a problem in peri-implant, that is, if you have a problem with the implant, those are kind of similar bacteria. Okay, so yes, if you have no teeth, you're not eating anything at all, I'm pretty sure there'll be no inflammation in the mouth. However, if your oral mouth is full of bacteria,
Yeah.
so you always have bacteria. If you eat chewing it with your gums, and if there's a trauma in the gums, then you'll see a problem again.
Well, that's good. I think a lot of people don't even think about it. We kind of think about, oh, we have teeth, and without those, we're probably fine. And that's why some people, and we obviously as dentists try to tell them not to, but some people say, let's just take it all out. It's easier. Got nothing to worry about. But there are still a lot of things in that sense that you you still have to manage, have to take care of.
Malnutrition is another, right? When you don't have teeth.
Yep.
So
Now,
you
what would you say, so systemic health, is there any, do you notice a difference in people's dietary health in the sense of what they may eat, how they eat, or maybe drink? Does that have any effect with the amount of inflammation they could get, which then could impact their systemic health?
Yes, they do have a research that supports that excessive intake of a carbohydrate does have a higher inflammatory rate. Okay, so there are a few research that talks about that. Other than that, I don't think I have read all to tell you everything about it. Of course, candy, sugar increases more chances of, because the bacteria flourishes in the sugar. So carbohydrate and the sugar, those are the two things I have seen a lot of research on. Other than that, I have not, to be honest with you.
Well, that's good to know. And then there's new research coming out every second, pretty much.
That is true.
So we've hit a lot, we've kind of are trying to just get at least a broad spectrum of covering systemic health and periodontal disease, inflammation in the oral cavity. Anything that, that we haven't maybe hit on, some things that you wanted to talk about or that could be useful.
I think another biggest part about the parental disease and its association in systemic is a pregnancy complication. So there are, if you look at the pregnant people with parental disease and compare them with the pregnant people without a parental disease, there are a lot of research on it. They found that the baby's weight are less than a normal weight. They can be born prematurely. And there are also there are lots of other inflammatory factor that causes a problem in the baby when they are born. So that's another thing we have to be really careful about. I know research says women have a less periodontal disease than men. I did not say it, research said it. However, there are still a very high percentage of female who still have a periodontal disease. So please, please, please go to the dentist, get it checked, make sure you are going into the regular maintenance care, because those smaller things make a lot of difference in your overall health.
And I'm glad you mentioned it, because that is something that I think as dentists, most of us are aware of, but as being a man, I don't really think as much about the pregnancy aspect in that sense, but it's no, it's really important, obviously. And I think one thing I wanted to ask you is, let's say, someone gets pregnant, a female gets pregnant, and she's knows her oral hygiene isn't good. Has there been any studies that would say, we don't want to scare anyone, but has there been any studies that show, yes, we know it wasn't great when you started, but you got it corrected while you were still pregnant?
So
The end, kind of results studies of that have shown that it's maybe been corrected and you didn't have any of the complications associated with it.
So I don't think there is a research where they actually saw a patient with a periodontal disease and a pregnant, and then studied long term to see when we took care of it what was the difference. Because as soon as they took care of it, they have found if you don't have the periodontal disease at that point of a time, you don't have those problems, right? So I don't. There isn't any, as far as I know, longitudinal study for that. But the short-term study, what they showed was only if you're pregnant, have a periodontal diseases, it doesn't matter. I mean, second trimester is all, of course, the safest period. But
Mhm.
having a teeth clean, just to have a teeth clean, you don't have to wait, because that you remove that inflammation is much better in any time of the pregnancy, rather than having it take, like saying that I will get it done at after the baby is born. Definitely, for sure.
Well, that's good. This is why we're here. We're trying to provide knowledge to everyone, and to hopefully help people, and to help in any way that we can. So I think that's all good information. I'm excited to hear all of this. What anything else that I feel like maybe we haven't touched on, or that you think we should know?
I think we have hit almost everything. I mean, there are so many
That
diseases.
we can think of.
Well, kidney disease, or what do you call it? Most of the time, you see cancers are also
Yeah.
linked, of course.
And
Or
that makes me think of something. Someone's going through a serious health issue, cancer. And a lot of times people may be worried about getting any treatment done because they're going through other sorts of treatment,
yes,
be it chemo, other medications, maybe possible surgery. But
radiation.
how important is making sure their oral cavity and periodontal diseases improved, or at least maintained throughout that process?
Dr. Bernstein, that's an amazing question, because when you have something like a cancer, your focus completely goes into that, and
Hmm.
you kind of forget about the rest of the thing. Uh, if if you look at it, if you have to go through the radiation, all your doctor is going to tell you to take care of all your teeth problem before you start the radiation, any part of the body. And again, think about having a lots of issues at the time of chemo and radiation. You have a more inflammation. I know I keep going in inflammation because that's the biggest factor that causes problem in your system. So if you have so much of inflammation, and when you have a disease like a cancer, you need every single body to work on that. And when you have a one part of a body that has so much of inflammation, those cells are going to divide and say, okay, which part am I going to go and take care of it? So if you take care of those things before, it might help. I'm not going to say there's a research to show direct correlation between those two, but it
Right.
will definitely help for your better health. And of course, you have a dietary restriction, you are going a chemotherapy, you're going through a lot. But overall, if you take care of the oral health first, you don't have to stop your cancer treatment, but at least get it checked regularly, so you're not neglecting the other part of the body as well.
Yeah, I mean, I think, as you kind of brought it up, with the cancer or other health complications. I think that's important, as well, to make sure everything is healthy, because it all is connected. It doesn't seem like it somehow. We think that it somehow stops in the in the stomach. Maybe I don't know what I guess people thought of at some point, but it seems like as the more we learn, we wonder, why did we not even think of that?
That is true. And we are going in the right direction, right? There are
Yeah.
so many people looking into so many things. I mean, thyroid, think about thyroid problem. Thyroid problem has also shown so much association right now with the periodontal disease. There was a couple of research which shows the healing gets slower. And that, I mean, in a patient who has a
Who
thyroid
has
problem,
inflammation?
yes. And see, there are just so many smaller things in your body that can get worse by having a periodontal disease. So, and I look at how much excited I get when I talk about taking off your periodontal disease. It's everything. You start from mouth.
Yeah, well, the good thing is, I think, and what makes us excited about it is it really is an easy fix in a way. Obviously it takes some time, and I know some people's concerns are financial, which is understood for everyone, but it's probably one of the easiest fixes. Working on the mouth and correcting it. And
That
that's
is
why
true.
that's why we get excited.
That is true. If you get, I mean, certain smaller things, right? Smaller things have so much value. Think about going to that one general dentist office. And I know we tend to be a little scary because I know most of the time I hear we're really scared of going to the dentist. But taking care of that oral health, making sure that one smaller thing, making sure that is taken care of so your overall health gets better or you move towards getting better. That's almost better. I mean, a diabetic patient, when you look at the research, when they did deep cleaning on a patient who had a very high HbA1c, and then after the reevaluation, they found the HbA1c was controlled, and they are still taking your diabetic medication. Don't
And
get me
that's with no other changes of, like, they weren't
yeah, no
actively
other
trying to change
changes.
anything else.
Yeah, they were taking the medication, regular medication, what they were regularly taking for their diabetic control, and wasn't controlled. But the inflammation part, because they had so much of a periodontitis, and they did the deep cleaning, and then they reval and rechecked it, and they that also showed that HbA1c can also be controlled if you control your inflammation in the mouth. So there is so much association, and if you actually look a little bit time out of your time, I know it's important, and go to the dentist, go to the
Right.
periodontist
It's
office.
easy. Hey,
It's
if you
very
can,
easy.
yeah, listen to us. We're dentists. Go to the
Yes.
we're promoting ourselves. No, but it really is about one of the easiest things to improve. And I think most people will figure out that in today's time, we're able to manage a lot of fear, anxiety a lot better at the dental office to hopefully give you a better experience
Yes.
to getting that correction as well.
Yes, and like you said, not knowing is not good anymore. You have to know how it is going, and you, as early detection is much better. Of course, prevention is better. If
Mhm.
you go from day in, I mean, regular dentist prevention is much better. But if you have a disease, now we have a means to control it, and that will help your overall health.
Well, that's perfect. I think if we don't have much more to cover, I think that's honestly a great segment to get finished up here.
Yes, I think we are very good. I think we give a very good education. Hope it helps at
Well, we are
least.
so thankful to have you on here, Catwall. I think we're lucky to have you in our area, in the community, in the Triangle area, and I think let's, before we get off here, you are at Tar Heel Periodontics. Which locations are you primarily at? Sell your office. Tell us a little bit about that.
Oh, yes.
Just give us a quick rundown, because
I forget that.
people are able to see you if they're in this area, and they can get great work done.
Thank you, Dr. Bernstein. So I work at Tar Heel Perio. My primary location is Garner. I work there Tuesday, Wednesday, Thursday. But I also go to Raleigh location and Cary location. So you can catch me any of those locations.
Awesome. Well, hopefully, today's podcast, I think, was a little bit educational for everyone, especially me. And we're so thankful to have you on here. Otherwise, I think that's it for today. Well, thank you.
Thank you so much, Dr. Bernstein. Have a good one.
Bye bye.